Class 4 antiarrhythmics, these are primarily going to be your calcium channel blockers. Remember, the L-type calcium channel is primarily responsible for phase 0 and phase 4, and these can cause PR prolongation, right? For the same reasons, because, ultimately, I just told you a minute ago, right? Here's your beta blockers, right? Beta blockers, we just went through this. They're going to cause lower levels of CAMP, and that lower level of CAMP will eventually, downstream, lead to decreases in calcium, and that decrease in calcium will cause lower heart rates at the pacemaker cells, right? This is going to be your L-type calcium channels, and they'll also cause decreased contractility at the ventricular myocytes, okay, because of the calcium-induced calcium release. What we're saying here is calcium channel blockers are essentially going to do the same thing. They're going to decrease calcium, they just have a different mechanism of action. Okay, so they're going to directly block calcium channel. And specifically, verapamil and diltiazem, these are going to act mostly on the heart, okay? And then you're also going to have your dihydropyridine calcium channel blockers, which are mostly going to act in the vascular system. Something like, nifedipine, for example. This is going to be mostly vascular system. And I went through those in great detail when we talked about the vascular system lecture. We went through all the mechanisms of action of where these medications act in relation to the cells. So I don't want to go into too much detail on that, but the concept is you can see that these calcium channel blockers are actually going to act very similarly to beta blockers. So class 2 and class 4 are very similar. They're both going to prolong the PR interval for reasons we already mentioned by prolonging phase 0 and phase 4 of the pacemaker potential. They'll also both decrease contractility, right? Because they'll be blocking calcium-induced calcium release in ventricular myocyte. Where would we want to avoid these? You wouldn't want to give these in an AV block because of the PR prolongation. That's the same concept.